We continue with the window of heaven points, bladder 10, heavenly pillar. Location, approximately 1.3 June lateral to 215, where the trapezius muscle inserts on the lower border of the occiput, close to where the major occipital nerve emerges. How to find? With the patient's head in an upright and relaxed position, first locate GB20 below the lower border of the occiput and between the insertions of the sternocleidomastoid and trapezius muscles. From there, palpate in the medial and inferior direction at an angle, at a 45 degrees angle until the finger comes to a halt against the bulge of the trapezius muscle. This is the location of bladder 10. For reference, if the practitioner places their left middle finger on GB20, the shorter index finger will pointing to bladder 10. Located on the same level is D15, approximately 1.3 June lateral to the midline and superior to the axis. First, palpable spinous process. Needling, 0.5 to 1 June vertically or slightly oblique in a dorsal direction. Caution, do not needle in a superior direction. Action indication regulates the qi, calms wind, and the shen benefits the head and sensory orifices. Opens the channel, strengthens the lower back, expels wind. Special features, window of the heaven point, important point for expelling internal and external wind. In contrast to GB20, bladder 10 is used in clinical practice mainly for pacifying internal wind. Small intestine and bladder pertains to greater yang, which opens on the exterior. Of the three yang, the greater yang channel are the most yang or most exterior. In addition, the area on the top of the body, like the occiput, is even more yang in relation, for example, to the inferior part of the bladder channel. This was two main implications. On the one hand, it means that the points in this area are yang in nature and can therefore be used either to tonify the yang, inability to support the body, or to expel yang pathogenic factors such as wind, epilepsy, or stiff neck. On the other hand, beginning yang and being at the top of the body, this area suffers from rebellious qi flowing out, and points in this area can be used to subdue rebellious qi, those having dizziness and headache. Being yang in nature due to its channel polarity and position, bladder 10 treats excess of yang causing mental problems, incessant talking, seeing ghosts, manic behavior. Being situated on the hinge of the occiput and being like a gate of yang qi, bladder 10 is reestablishes the balance in the flow of yang to and from the head, and can be used when there is excess yang above and deficient yang below. Soft legs, weak legs that cannot sustain the body. Bladder 10 is an important point to expel both interior and exterior wind from the head, and is a major local point for occipital or vertical headache from any origin. It can be used to expel exterior wind in the case of stiff neck and headache deriving from invasion of wind cone. Can extinguish interior wind and is used in this way mostly for occipital headache deriving from liver wind rising. However, it can be used for virtually any type of occipital headache. As bladder 10 is situated at the point where the bladder channel and the eye system emerge from the brain, this point can be used to clear the brain and stimulate memory and concentration. It has a special effect on the eyes and is used to increase vision, especially if the eyesight is diminished from kidney deficiency. Finally, it can be used as a distal point for bilateral acute lower back ache. This point is usually needled first with reducing method, while the patient in a standing position gently bends forward and backwards. After a few minutes of this, the patient is made to lie down and local points are used on the lower back. As a window of heaven point, bladder can regulates the ascending and descending of qi to and from the head and subdues rebellious qi. This is another reason why this is a major point for the treatment of headaches from liver yang rising and mental emotional problems. It extinguishes wind and subdues liver yang in dizziness, muscle cramps, stiffness of the neck with inability to turn the head, headache, feeling of heaviness of the head, epilepsy. It also expels exterior wind in aversion to cold, fever, body aches. It also strengthens the greater yang channels in inability of the legs to support the body, soft legs, weak legs that cannot sustain the body. It also clears the brain in mental confusion, difficulty in concentrating, and poor memory. Opens the sense orifices, eye pain, red eyes, blurred vision, lacrimation, difficulty in speaking, nasal congestion, loss of sense of smell. It also removes obstruction from the channel in pain in the body, pain in the shoulder and back, and opens the mind's orifices in manic behavior, incessant talking, seeing ghosts. In common with the other window of heaven points, bladder 10 is indicated when inversion qi, chaotic, and rebellious qi rises to the head. This may give rise to dizziness, headache, heaviness of the head, stiffness, and epilepsy, as well as congestion, pain, and swelling of the throat, eyes, and nose, while at the same time the lower part of the legs are unable to support the body due to unbalanced distribution of qi. The use of bladder 10 for disorders such as inability of the legs to support the body, pain of the body, and headache accompanied by lumbar pain is a reflection of the principle of selecting points above to treat disorders below. Like lung 3 and SI16 also points of the window of heaven. Bladder 10 is further indicated for mental disorders characterized by mania and incessant talking, as well as for disorders characterized in classical texts as seeing or communicating with ghosts, and therefore attributed to some form of demonic possession. In terms of modern medicine, this indication refers to various forms of severe mental disorder, including schizophrenia. Finally, there is some similarity between the indication of bladder 10 and GB20, with points being located close to each other. GB20, however, is much used clinically both to expel exterior pathogenic wind and to pacify interior wind, while the clinical use of bladder 10 is primarily confined to pacify the interior wind.